Register for Alert VI emergency notification by visiting vitema.vi.gov. Make a plan.
Be prepared.
Stay informed.
But what you saying, Jimmy? Me saying a hot minute, you know. We're going on today, it's been a hot minute for real. You want to know something? My mother told me that I can't come out my house for the COVID-19. I know we ain't safe out there for a little bit, but still I just have some fun though. Well, my say can't leave the house unless I'm vaccinated. But you scared of the vaccine? Nah, sis. The vaccine's safe.
VI people, you must stay at work. COVID-19 is not a joke. It's much more than good hygiene. Give your children the vaccine. Education is the golden rule. Children need in-person school. They miss music, dancing and sports. Vaccination is better, not worse.
I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe. I want to see my friends and family. Playing with them makes me happy. It's safe, mommy. The vaccine safe, safe, safe.
Children can become infected, get sick, and spread COVID-19 to others. Widespread vaccination is a critical tool to help stop the pandemic. People who are fully vaccinated can resume activities that they did prior to the pandemic. The MCH division encourages you to get your children ages 12 years and older vaccinated.
I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe.
Brought to you by the Virgin Islands Department of Health MCH program.
Good day. Welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of September 20th, 2021. For the benefit of the radio listening audience, I am Government House Communications Director Richard Mota. For this afternoon's briefing, I am joined by Health Commissioner Hussein Encarnacion to share the latest COVID-19 data and information on where Virgin Islands residents can get a free COVID-19 test and vaccine this week. Also joining me this afternoon is Mr. Dwayne Benjamin to announce the winners of this week's Vax to Win lottery on behalf of Director Raymond Williams of the Virgin Islands Lottery Office. Before we go to Commissioner Encarnacion, this afternoon, I have a couple of things. First, I need to take this time to extend condolences to the family of former St. Croix Senator and Korean War veteran and lifelong community activist, Mr. Edgar Isles. I extend my heartfelt condolences on behalf of Governor Bryan, the entire Brian Roach administration, to former Senator Isles' loved ones and all in the community who mourn his passing. I personally extend my condolences to his son Ray and the entire Rotary West family. May his soul rest in eternal peace. 4 years ago today, Virgin Islanders in St. Croix woke up to the destruction caused by Hurricane Maria and the reality of a second Category 5 hurricane making landfall in the territory in 2 weeks. Since taking office in 2019, the Brian Roach administration has made steady progress on the more than 1,500 recovery projects, including the more than 220 projects that are currently underway, including the modernization of the Raphael O. Wheatley Skills Center, the Gladys Abraham School, which is scheduled for completion this coming January, the demolition of the Arthur A. Richards Junior High School and Evelyn Williams Elementary School, the paving the way for the construction of the new Arthur Richards K-8 school, which will be constructed on that campus, reconstruction and proper drainage installation at the Gallows Bay Road, and reconstruction and proper drainage installation on Maffali Road, rebuilding of the Vincent Mason Pool, and many, many more. So that's just a glimpse of some of the ongoing recovery projects and capital improvement projects that the administration is undertaking. This week, we saw the return to students to one of our other elementary schools in the territory, which unfortunately had to revert to virtual learning. I want to take this opportunity now to say that while we take every precaution moving forward, we won't be successful and our children won't be successful unless we do our part. Today, I am making a heartfelt appeal to the faculty and staff of our schools and to the families of many of our students to encourage them to get vaccinated. We have entrusted all of our teachers, faculty, and staff with the safety of our students, and so we want to ensure that you continue to do the things necessary to make sure that our children are safe. Do the things, keeping our campuses healthy and take the necessary steps. If not for you, do it for them. On behalf of Governor Bryan and the entire Brian Roach administration, I want to say welcome back to those students, teachers, and staff returning to the Joseph Gomez Elementary School. We pray for a safe and successful school year for all of those individuals. At this time, I will turn over this afternoon's briefing to Commissioner Encarnacion. Commissioner Encarnacion.
Good afternoon, and thank you, Director Mota. As of September 18, 2021, a total of 178,308 tests have been conducted in the territory. Of those tested, 6,458 individuals have tested positive. Our 7-day positivity rate is now 4.39%, which is a significant increase from last week's 3.5%. There are currently 206 active cases in the territory, 144 on St. Croix, 59 on St. Thomas, and 3 on St. John. 5,994 cases have recovered, and unfortunately, there have been 67 fatalities. And no matter how many times I have to address the fatalities, I feel, and I know that families and friends of those that lost those to COVID-19 also feel. And because of that, I encourage you to get vaccinated and follow basic precautions such as mask wearing and hand washing and social distancing. From our hospitals, the Governor Wong F. Louis Hospital Medical Center reported 5 COVID-19 admissions with no patients ventilated, and the Schneider Regional Medical Center reported 0 COVID-19 admissions. Dr. Ty Hunt Caesar in our hospital huddle this morning reminded JFL to please be cautious and look out, because we actually had a dramatically increase of numbers in the St. Croix district. And we want you also to be aware, be cautious if you have any symptoms. I will speak about monoclonal antibodies a little later on. However, it is available. If you're symptomatic, please go get tested. If you're positive and you meet the criteria, please accept the monoclonal antibody. You are encouraged to accept the treatment early when the treatment team contacts you. Many people actually say no, and then when they feel really bad, they call and they want it. At that time, if you're hospitalized, vented, you are not actually meeting the criteria for monoclonal antibodies, and it's actually not going to be much help for you then. If you have had COVID-19, there is no need to wait a certain amount of time after recovering from COVID-19 to get the vaccine. At first, I think the conversation was 90 days. It is no longer recommended to wait 90 days after being positive with COVID. You can go right after recovery and get your vaccination. And the reason why is because even though you have antibodies that have been built up from getting COVID-19, it does not prevent you from acquiring any of the other variants that are out there. To get vaccinated, please call 340-777-8227 or simply walk into any of our community vaccination centers. You can also schedule an appointment online at covid19usvi.com/vaccines. Families can also call the hotline to schedule an appointment for homebound relatives. Our mobile strike team will come to the homes of homebound individuals. We've been very successful with that. If you are the parent or guardian of a child aged 12 and up, please make sure to accompany the child to his or her vaccination visit and bring an ID for both the child and you, as well as the children's birth certificate. Director Mota just spoke about schools being open and then having to be closed. If your child is 12 and up and can be vaccinated, this actually may save his or her life, as we are hearing that more and more children throughout the nation is actually becoming hospitalized. And as you know, what we see always comes after the nation actually experiences some of the unfortunate tragic events related to COVID-19. To schedule an appointment for a COVID-19 test, please call the epidemiology hotline. The hotline is open 7 days a week from 8 a.m. to 10 p.m. at 340-712-6299 or 340-776-1519. You can also schedule an appointment online at covid19usvi.com/testing. Pop-up testing on St. John is available at the VI Port Authority gravel lot on Wednesday from 1 p.m. to 4 p.m. This is now some news that we just heard from the FDA. The FDA has made, Food and Drug Administration, FDA, has made a ruling on Pfizer vaccine boosters shot where booster shots were approved for individuals 65 and older, healthcare and long-term care facility workers, and those vulnerable to severe COVID-19. Starting immediately, booster shots are available for any individuals who are immunocompromised, 65 and older, or healthcare and long-term care facility workers who completed their vaccine series at least 8 months ago. This is for Pfizer only. The Virginia's Department of Health will continue to also administer third doses for immunocompromised individuals for both Pfizer and Moderna. We're also expecting other matters to be addressed by the FDA, such as vaccines for children under age 12. A few weeks ago, Governor Bryan announced a new $250 incentive program, and I am pleased to announce our plans for distribution of gift cards. Starting Tuesday, September 28, the Department of Health will distribute $250 gift cards to up to 9,999 individuals who meet the following criteria. If you receive one dose of a first dose vaccines, one dose series, which is the Johnson & Johnson or the Janssen, between August 9, 2021 and September 30th, 2021, you receive 2 doses to complete your vaccine series of any second dose vaccine between August 9, 2021 and September 30th, 2021. If you meet these criteria, distribution starts next Tuesday and then continues Monday through Friday from 9 a.m. to 3 p.m. These sites will be open until October 31st. More news on this will be forthcoming. Locations for pickup are the community vaccination centers on St. Croix and St. Thomas and the Morris de Castro Clinic on St. John. Just as a reminder, the community vaccine center on St. Croix is at the old Nissan building, and the community vaccination center on St. Thomas is at the Roy Lesnar Hospital, 2nd floor at the Community Health Center. and of course, Marissa Castro Clinic on St. John. Please bring your vaccination card or electronic vaccine confirmation and a valid government-issued picture ID to collect your card. Reminder, if you are sick, suspect you have COVID-19, or a close contact or have tested positive for COVID-19, please stay home. Traversing throughout the community and breaking quarantine or isolation puts others at risk and can be very dangerous for those who with underlying health conditions. The highest mode of transmission is still community spread. That means you can actually acquire COVID from anyone. The individual that you stood up, talked to, having a drink, you're having a drink, you're having a drink, you're eating, they're eating, you can actually contract COVID-19. So please be very careful. Don't forget the Healthcare Heroes special drawing, which will be held on October 4th. The last day to register, October 1st. You can register online at www.vaxtowinusvi.com. Special hero shout out to the Department of Health, Family. I want to start with Dr. Hunt Caesar. She actually was asked to speak nationally in regards to monoclonal antibodies and the work that she actually has been doing. I think that she's spearheaded the monoclonal antibodies, and you know we've actually been getting a large amount of positive cases. And it is because of her work with monoclonal antibodies we are where we are right now in terms of decreasing our hospitalization and, of course, decreasing deaths. And, of course, cannot go ahead without working with Dr. Nicole Cragwell-Sims, who also keeps everyone at bay in terms of her psychological, mojo that she puts on everyone. So we keep smiling, we keep laughing. It's not an easy task, but I think that looking at who we are as a team, I think we work extraordinarily well together, and I really want to thank each and every one of you, Shana, everyone from the Commissioner's Office, all of my exec team, especially Dr. Mark Jerome. Dr. Mark Jerome is I don't want to say his age, but I have to tell you, he goes to the CVCs every single day, and he does the assessments on the patients that have questions or may have some mild symptoms as a result of the vaccine. He is someone to be honored. I want to honor all our Department of Health heroes, as we go through the pandemic. We've been doing this for over 20 months. We have some time to do. Please don't get tired on us. Let's stick together as a family and get through this. To keep up with the latest information, including COVID-19 epidemiology and vaccine data, please visit the U.S. Virgin Islands Department of Health Facebook page or our website, www.covid19.com. For COVID-19 health information alerts, text COVID-19 USVI to 888-777. And before I turn it back over to Director Mota, I cannot not speak to Dr. Ellis and her team. So epidemiology and communicable disease, everything that you guys do, we are grateful. Thank you very much.
Thank you, Commissioner, and I echo those sentiments that the entire team is just really awesome, doing what they do every day to help protect our community and inform our residents on what they need to do to help protect themselves and their loved ones as well. I want to reiterate, though, before we move on this afternoon, that this thing about our students returning back to in-person learning is very important. So for those who may have joined the conversation after we started this afternoon, I really want to reiterate, because that information is super important. Last week we welcomed back to in-person learning pre-K through third grade students at 2 of 15 of the Department of Education's learning centers. Today we welcome back again another set of students to one of those other institutions. This is to say that while we recognize the in-person learning experience to be what is best for our students, and while we take every precaution in moving forward, we won't be successful and our children won't be successful unless we all do our part. And I want to stress that we all need to do our part. Today, we are making, as an administration, a heartfelt appeal to the faculty and staff working within our schools to protect our children and their families by getting yourselves vaccinated. I know everybody's tired of hearing it, but we know based on the data, based on the facts that are out there, that offers the greatest level of protection in conjunction with doing all of the things, the masking and social distancing that we know have been working. Doing all of those things together offers the greatest protection that we have at our behest right now in the fight against the spread of COVID-19 in our community. And so we're urging everybody to really, just step up. I know people are tired, everybody's exhausted, but this is a life and death battle for many, and we all in the community need to do our part. Like I said, we are making this heartfelt appeal today. All of you are entrusted with the safety and well-being of our students, most of which cannot be vaccinated themselves. So it is disappointing to learn that in many of these instances, students continue to have their learning environments disrupted through no fault of their own, and in most cases, because adults have tested positive and led, the adults being tested positive have led to a lot of these school closures. And so we are asking you to strongly consider your role in keeping the children on our campuses healthy and safe and taking the necessary steps. As I mentioned earlier, if not for you, please, please do it for them. So I just wanted to reiterate that message because it is very important before we move on. As I mentioned at the top, here to discuss the final winners of the Vax to Win lottery on behalf of Executive Director Raymond Williams is Assistant Executive Director Dwayne Benjamin of the Virgin Islands Lottery Office.
Thank you, Director Mullen. Good afternoon, everyone. Good afternoon, Virgin Islands. This week's winner for the Vax to Win lottery, representing the District of St. Croix, is Mr. Salvador Gonzalez de la Cruz. Mr. Gonzalez has been fully vaxxed, and he is the recipient of $100,000. The winner from the St. Thomas St. John District for the week is Ms. Charlene Foy. She too is fully vaxxed and is the recipient of $100,000. We thank all of the participants that participated in the Vax to Win lottery, and we too encourage all Virgin Islanders who have not taken this opportunity to get vaccinated to take so seriously and get it done. Thank you.
Thank you, Mr. Benjamin. Congratulations again, Shirlene Foy and Mr. Salvador Gonzalez de la Cruz. Thank you for taking your best shot and for doing your part to help protect our community. Thank you to all who went out and took their best shot. We are safer as a community today because many of us have taken that step. Moving forward, don't forget that there is a special drawing just for healthcare workers and allied healthcare workers. This includes nurses, physicians, paramedics, and the like. If you want to register for this drawing, you can do so online at vaxtowinusvi.com, or you can also do so by calling the Vitima hotline at 340-777-8227, or you can also just show up in person at any of the Department of Health's community vaccination centers, or also by going to the St. John Administrator's Office. The deadline to register is October 1st. So the first prize for the Healthcare Heroes drawing is $25,000. The second prize is $10,000. And the third prize is $5,000. 3 winners will be chosen from the St. Croix District, and 3 winners will be chosen from the St. Thomas and St. John District. And some other non-COVID related news this afternoon: the Virgin Islands Housing Authority, in conjunction with the St. Thomas Water Island Administrator's Office, is conducting an initiative to remove abandoned and derelict vehicles from the housing communities in the St. Thomas District. If you have an abandoned or derelict vehicle in one of these communities, we're asking you to please remove it before the task force does. Failure to do so will result in a $1,000 fine for your first offense and a $2,500 fine for your second offense. Please see the property manager at the respective housing community, or contact the St. Thomas Water Island Administrator's Office at 340-693-4350 for more information. I will repeat that number. That number is 340-693-4350. As we bring this afternoon's briefing to a close, we here at Government House are proud to celebrate National Hispanic Heritage Month, which we celebrate on September 15th through October 15th each year. Here in the territory, we traditionally celebrate Virgin Islands Puerto Rico Friendship Day during this period, and more specifically on the second Monday in October. The true importance of this month and VIPR weekend, however, is not only to recognize, but to truly celebrate the achievements and contributions of our Hispanic brothers and sisters and celebrate the rich heritage and culture and cultural ties that bind us together here locally. I ask that the community join us in celebrating these achievements and our shared heritage this month and every day. I will take any questions from the media now if we have any. And so we have Suzanne Ellis from the Virgin Islands Source here in Government House with us. Thank you for joining us, Suzanne. Your question?
Thank you, Richard. Good afternoon, everybody. I do have a few questions today. One of them, the Housing Finance Authority is apparently very far behind in distributing any rent checks to people that qualify. According to our reporting, they have $39 million that has to be distributed by the end of the month, and they've only sent out 20-some checks out of 500 applicants. Any moves by the governor as far as to extend the moratorium or anything like that?
Yeah, I can take that question. So Governor Bryan is working on extending the local rent moratorium. I'd just like to clarify, however, that the $39 million that was awarded to that program far supersedes, I think, what the qualification is. We've had 517 individuals in the territory who are a part of that program, who are eligible for that program, who meet the qualifications. Those individuals are being paid out by the parameters of the federal guidance for that program. And so the $39 million, and I would seek to clarify that the Virgin Islands Housing Finance Authority has until the end of this month to expend that $39 million. I think that program has actually been extended for the territories and for many of the states, as there has been issues, not just within the territories, but statewide, throughout the contiguous 48 states in the nation, with the exact rollout of this emergency rental assistance program. Here locally, we have 517 individuals who are qualified and eligible for that program, and those individuals had started receiving benefits already under that program. But I want to make clear to the community that that the $39 million is perhaps not something that we will, meet in terms of expending all of those dollars. But I want to reassure the community that 100% of the eligible applicants who are receiving benefits in this program are getting those benefits. So right now, we have 517 people who are eligible, and they are receiving their benefits. We continue to encourage people to get to go to the Virgin Islands Housing Finance Authority and to see if they are eligible, because to your point, there is a wealth of resources there, and so it would be a shame if there are if there is one family in the community who is eligible for it who doesn't take advantage of it. And so that's part of our push. We want people to go out there and take advantage of this program. And so for those of you who are listening You can find out whether you are eligible for this program by going to the Virgin Islands Housing Finance Authority's website at vihfa.com or .gov/ERAP. That is vihfa.gov/ERAP. There you can find eligibility requirements and you can get an application and you can find out if you're eligible for that program.
Great, great. So if you don't expend the $39 million, will you have to send it back? Or
I would refer that more than likely, if that full funding is not expended, it will have to go back to the federal government. Unless the federal government, of course, makes an extension or grants some other type of amendment to that program which allows the use of those funds. So that's also a possibility as well.
great, that sounds good. Also, can you tell us anything more about the death at Golden Grove?
I do not have any information outside of what has been reported in the media. I know that the department, or the Bureau of Corrections has said that they had a unfortunate death of an inmate, but they don't have any details currently, and so I would allow whatever investigation that is occurring behind the scenes to be completed before any comment is made from Government House. But in terms of any additional information that has already been reported by the Bureau of Corrections, I do not have that.
Okay. And another question about Senator Blyden and not sticking to the quarantine after he was given 2 tests, proved positive, and 2 tests for COVID. Is there any kind of punishment or fine that can be, do you plan to give him any fines or punishment?
Again, I would say that I'm not familiar with the details outside of what has been reported in the media this morning about Senator Blyden's case. I know that very early in our response in this administration's response to COVID-19, there was a push to seek some sort of more leverage to be able to enforce laws related to individuals not complying with COVID-19 health orders by the legislature. I don't think that push was successful. And so outside of the not knowing any of the specifics with Senator Blyden's case, I can't comment any further. I'm not sure if the Department of Health would like to provide any information on that.
From whether or not the test was actually positive, I can't comment to that. You know, that's HIPAA related, so there was no way. And if there's any investigation ongoing, I still wouldn't be able to comment on that as well.
Okay, I understand that. So does that mean, Richard, that there is not any penalties that have been established for people who...
Outside of what has been expressly defined in the governor's executive orders, where individuals would be subject to a fine of either $50 or $100 for the masking mandates, there is no law in the territory right now that gives the executive branch or any of its enforcement authorities the ability to prosecute or move forward with any type of enforcement on individuals who don't comply with those, for example, a quarantine order as being alleged in this specific instance.
Okay, and finally, has there been any update on a buyer for the refinery?
No, I do not have an update to share today on that.
That's all for me. Thank you.
Thank you, Suzanne. Go ahead, Ernice, Virgin Islands Consortium.
Yes, thanks, Richard. Good afternoon. I want to follow up on the matter with Senator Blyden here. the Department of Health, even the Department of Education's recent releases at the end always state that if someone knowingly is, for example, COVID positive and knowingly comes into contact with other individuals, that person, that individual, is subject to fines or imprisonment. Is that not factual?
There is, like I just mentioned to Suzanne, based on the governor's executive order, which still exists under the emergency declaration, which we are currently under, there is a penalty under, I believe it's Virgin Islands Code, the Title 14 of the Virgin Islands Code, Title 14 or Title 16. There is a penalty, financial penalty for individuals who do not comply with that. I was speaking largely to any, any recently passed criminal laws that regulate COVID-19 specifically. What the law that exists under the governor's executive order speaks to is failure to comply with the mandates of an executive order. We don't currently have anything on the books legally that speaks to an individual who is violating a public health order. Let's say, for example, an order by the Department of Health to quarantine for 10 days. And if an individual doesn't do that, there isn't any law on the books right now that currently regulate that. So that's what I was speaking more specifically to, sir.
Okay, Richard. So Title 14, Chapter 43, subsection 886 of VI Code states, whoever willfully exposes himself or another afflicted with any contagious or infectious disease in any public place or thoroughfare, except in his necessary removal in a manner that least dangerous to the public health, shall be fined not more than $200 or imprisoned not more than 1 year or both. That is VI Code. So are we gonna investigate the matter with Senator Blyden, or are we just gonna, because this is VI law?
Sure, but like I mentioned, we have what was put forward in the executive order, and you just read something from the Virgin Islands Code that speaks to an infectious disease. But like I mentioned, that is what you mentioned there is imprisonment, but it doesn't clearly define what that is and what can be prosecuted by a court of law in terms of, it doesn't provide any further guidelines other than what you've read. And so the law is vague and it needs to be clearly defined, and that's the point that we're making.
So, Richard, so just to step this a little bit here, what part of it you're saying is vague? It speaks to $200 imprisonment or not more than 1 year or both. What part of it is vague?
The imprisonment part, the penalties. So you have a penalty defined, but it's saying an infectious disease. And again, I want to bring back to this is we have COVID-19. This is something that we've recently, petitioned the legislature to make this law, to give the executive branch more teeth to be able to, hold these individuals accountable in a court of law who violate this specific provision. I think in your own publication, you've reported on individuals who have provided false COVID-19 tests to the Virgin Islands Department of Health and have been arrested, and the court has since thrown out their cases because they didn't meet certain provisions or certain specific provisions under whatever legal mandates that they should meet. And so that's what we're saying here, is that the legislation, or I don't know if it needs legislation, but the law needs to be a lot more clear. Something like this, by saying you either pay a fine or you're subject up to, it is not as specific as you think in terms of the interpretation or your reading currently today of Title 14 of the Virgin Islands Code. And from the administration standpoint, that's all we're saying here today, is that if we could get some more cooperation on getting some specific, saying if you violate this, you are subject to this. That's all I'm saying. Your reading of the code is saying if you knowingly, and so just to be clear, the key word here when you read Title 14 is if you're knowingly. You have to meet a burden of proof in a court of law when you're talking about knowingly. And so the government can't provide any, or at least I'm not privy to any information. The government would have to meet that standard of proving that this individual or any individual who went out, who was COVID positive or found to be COVID positive, knowingly knew that they were COVID positive and went out and transmitted. And so that's the legal standard that you have to meet in court. And so that's what we're saying. We need to tighten these laws before we can go out there and actively enforce things.
So I think you provided some new information there before I continue on the same matter. All the cases relative to negative COVID tests, all those individuals who were arrested, those were thrown out, you're saying?
No, I'm saying that there was reporting I thought it was your publication. It could have been another publication, but there was a couple.
We reported, reported that some were thrown out, but were all thrown out is what
I don't know. I'm just talking about what I read in the reporting. So I know that there was at least one couple whose case was thrown out. And so that's what I'm saying, is that the legalese here is not cut and dry. And so I want us to be very, very careful in what we're saying. And so I just wanted to make that point. That the law needs to, in order to stand up in a court of law, in order for you to be able to convict somebody and ultimately, render any financial penalty or imprisonment, the law in Title 14 has to be very, very clear and very, very specific. And I'm saying here that it is not as clear and as specific as it should be. And so that's an issue.
Some of those individuals were fined and they were sent back to the destination. So they were fined, some were fined 500, and they were sent back to the destination. You don't want to keep them.
Right, and so to my earlier point, they were fined based on violating an executive order. So there is clear language as part of the governor's executive order during this ongoing public health state of emergency. They were fined based on the language of violating the governor's executive order, not necessarily based on Title 14.
Let me ask the commissioner. Commissioner Encarnacion, we have here a law stating whoever willfully exposes himself or another afflicted with any contagious or infectious disease in any public place or thoroughfare, except in his necessary removal in a manner that least dangerous to the public health, shall be fined not more than 200 or imprisoned not more than 1 year or both. You have a VI, the Department of Health has the COVID-19 task force with a senator who admitted to being tested twice, once at the legislature, the same day by the VI Department of Health. The same senator is stating that the Department of Health told him to quarantine for 10 days. The same senator said he then went home and took his own test at his house, and that came back negative. We haven't seen that test. And that same senator, 2 days after, goes to an environment with over 7 people entertaining themselves. Is that enough probable cause, so to speak, to for the COVID task force to take action against the senator? Is that enough or no?
I'd like to comment on that by actually saying this. So bear with me as I say this. As Director Mota is saying that, of course, you have to do a lot of investigation. And that being said, the investigation is actually ongoing. And because of that, I am unable to comment.
All right. All right.
So Ernest, before you go, I just want to make clear. I just want to make clear, because to the commissioner's point, I think the premise of your question your questioning this afternoon came from a space where there was already some sort of conclusion that an investigation wasn't ongoing. And so to the commissioner's point, you know, the Department of Health has a certain responsibility. The COVID-19 task force has a certain responsibility, and here everyone is entitled to due process, even under, you know, you cite Virgin Islands Code. We know that people are entitled to due process, and so I just want to make clear to you and to even the listening audience that there's an assumption that an investigation isn't underway here, and so I want to say that is certainly not the case. Thank you, Commissioner, for making that point. So,
well, yeah.
you have another question?
Yeah, I just wanted to say that, you know, I'm grateful that she followed up on that. Prior to that, we didn't know if an investigation was going. You know, when we had our interaction there, you didn't mention nothing of that sort. So I appreciate her for bringing that to the fore. I suppose a quick follow-up here would be, how long do we expect that investigation to take, Commissioner?
I won't be able to say at this point in time, but thanks for the question.
Yeah, that would be a more appropriate question for the Virgin Islands, the Department of Justice, sir.
Okay, so a follow-up with the COVID task force. Who does the COVID task force respond to, I suppose?
The task force actually responds to the commissioner right now, the commissioner designee of the Virgin Islands Police Department. Of course, our environmental health is also involved in the task force.
Okay. All right, Commissioner Richard, thank you.
Thank you for your question, sir. I think we have another reporter from the Virgin Islands Daily News. Go ahead, joining us virtually.
Hi, good afternoon.
Good afternoon.
So kind of along the same line of questioning about Senator Blyden, based on these kind of allegations are pretty concerning. What would you say, just for anyone who is thinking, you know, we are expecting our leaders and our senators to be following this COVID-19 protocol, and how can we expect their constituents to comply to those as well if we're seeing this kind of behavior?
To that, I think that it's I think it's fair, and I'll give you an example. I don't care who you are within a territory. Public health is all our business, and I think that we are all responsible for the health and safety of the person that's next to you. You know, you all know that Commissioner Barry Benjamin was positive COVID, and she's healing well, and I thank God for that. I've kept in contact with her. We actually spoke in the press conference together. I think you all also know that. And so as Commissioner of Health, I took the responsibility and I quarantined for the days that I needed to, and I was tested. Of course, I'm negative. And so each and every one of us need to take full responsibility for ourselves, our loved ones, and everyone else around us. So it doesn't matter who you are. You're not, just like you are not exempt from catching COVID, you're not exempt from following the guidance that Department of Health and Governor Bryan has put in place.
Great, thank you.
Thank you for your question. Do we have any other, I don't think we have any other reporters on the line who are joining us virtually. I will give Ms. Ellis from the VI source an opportunity to ask any other additional questions since she is here in the room with us. She is signaling that she does not have any other questions. So that concludes our briefing this afternoon. Thank you all for your questions today. Remember, please wear your mask, please practice social distancing, and get the vaccine now that it is available. Thank you, and we will see you next week, Monday, September 27th. Have a good day.